A frequently cited quote, often attributed to Gandhi or Pearl S. Buck, states that the true measure of society is how it treats its most vulnerable or weakest members. Hubert H. Humphrey defined the moral test of government by how it treats children, the elderly, the sick, the needy, and the handicapped. And lastly, Albert Einstein suggested the world is dangerous not because of evildoers, but because of those who remain passive. Welcome to A Healthy Dose. I'm Julie Stautland, and today we are continuing part 2 of our discussion on Maid's impact on Canadians with disabilities. Once again, we welcome Alexander Raikin. He is a visiting fellow in bioethics at the Ethics and Public Policy Center, and his writing has been widely cited in major newspapers and academic journals. Welcome back, Alexander.
Billy, it's a pleasure to be on.
You left me speechless last time, so we're back here, and we need to recap so that people understand. Let's recap last week's episode. When did Canada first approve Maid? What changed in June 2016, and what changes are still coming in March 2027?
So the Supreme Court of Canada ruled unanimously that Canada must implement some system of assisted dying, of euthanasia. In 2016, Parliament had its first go at it, and they legalized Maid, medical assistance in dying, for those who are terminally ill. In 2021, Canada expanded that further to patients with just a chronic illness, while at the same time removing quite important safeguards, like removing a minimum waiting period. And now, in 2027, so next March, Canada is on path to legalize Maid for patients with only psychiatric conditions.
Wow. We discussed personal stories as well of Canadians with disabilities who desired social support but were offered Maid. What safeguards were not supposed to protect them? They were not used to protect them, I was trying to say.
Well, Canada, so one of the safeguards is that Maid providers, Maid assessors, have to inform patients that there are alternatives, and they have to
Right.
inform them of reasonable alternatives.
Right.
We know that there's been cases where Canadians were unable to receive alternatives to Maid, that they were only offered Maid instead of alternatives that involved disability or social support. And I do just want to mention, I'm looking at the 2024 data as well, is that in 2024, 48.5% of all Maid deaths were patients who reported to their Maid assessors that they were choosing to die from Maid, at least in part because they believed they were a perceived burden on family, friends, and caregivers. There's another statistic that 23% of Canadians in 2024 were doing so because they felt isolated or lonely. Both of those figures are massive increases from just 2019, roughly increasing by half for each of those figures. This is, I mean, it's insane if you pardon
It
my
breaks my
French.
heart. It just breaks my heart to hear that, to know that people felt that way, that they felt like this was going to be better for everyone else. It's awful. Okay, then there is the issue of Canadians with mental illnesses who are at risk of coercion toward Maid. How has the system failed to offer better psychiatric care or counseling?
Some of the cases that I've covered were patients who had depression and who had diabetes or arthritis. And instead of being provided with support for their PTSD,
Mm.
support for their depression, were instead being offered a pathway for Maid. I don't know of any other Canadians, except those Canadians who have disabilities or physical illnesses such as those, that are being offered suicide instead of suicide prevention.
Yeah. It is crazy. Okay, so when we come back, we'll look at the criteria surrounding natural remaining life and rigorous scrutiny requests. Right after this, so much more to unpack. Stay with us. Considering how long someone has left to live, according to medical experts, was supposed to be a top priority so that people weren't easily choosing Maid or being suggested Maid. where other options should be entertained. The value of someone's life should be first and foremost. So let's talk about that. What did the courts assume the natural remaining life expectancy would be for those pursuing Maid?
The courts assumed that the vast majority of patients would be dying in a matter of days or hours. They assumed that there would be almost no cases where patients who would die would have a natural life expectancy of more than 6 months. The
Okay.
reality on the ground, and we only have the data from this from Quebec because no other jurisdiction in Canada records that data. But the reality on the ground is that at least 21% of Canadians, according to their MAID providers, had a natural life expectancy, of more than 6 months. This is a dramatic increase in the data in just a very short time period. MAID was only legalized a decade ago.
Wow. So then what do they really mean by the term reasonably foreseeable and imminently dying if it doesn't seem to be following through that way?
That's a good question because it's unclear what exactly Canada's parliament intended. Natural life expectancy or a natural pathway for death are not medical terms. These were terms that were invented
Mm.
by the Canadian Parliament, just the same way as they invented the term medical assistance in dying.
So, how did the acceptable changes in life expectancy affect the number of people choosing Maid?
That's a good question, because we do know that technically, MAID is divided between track one and track two. Track
Okay.
one is when there's a natural death is reasonably expected. That's the terminology that's used. And track two is when a natural death is not reasonably foreseeable. Most patients who die, according to the data, almost all, are track one. At the
Mm.
same time, though, and this is where the data becomes murkier, is that the life expectancy for those who have track one has increased dramatically.
Mm.
And there's no good reason for why this is happening. We have data in the Netherlands that just a decade ago, virtually no one had a life expectancy that was more than days or weeks. And
Wow.
yet in Canada, we now have that, according to the data just in Quebec, that close to half now have a life expectancy of more than a month. This is a dramatic increase, and the largest increase, I should say, are for those patients who have a life expectancy of more than a year.
Wow. Now, you mentioned the Netherlands, and I'm actually half Dutch, and I had a family member who chose Maid in the Netherlands. So, what other countries? Are there any other countries that you can compare Canada to? Are they similar to the Netherlands, or are they similar to us?
Canada has the fastest growing euthanasia program ever seen. The Netherlands is the only
Why?
country. Why is it? It's another fantastic question. The Netherlands, for instance, they effectively decriminalized euthanasia in the 1980s
Mm.
and legalized it in the early 2000s. Yet for them, it took decades for them to have more than 4% of total May deaths,
Wow.
more than 4% of May deaths as a
And
percentage
yet
of
we
total
are like,
deaths.
okay, no, this is really great. This is
We
great
did
for
that
family.
exactly. We did that in just a matter of years.
Oh my goodness.
We just did that in a matter of years. We are the only other jurisdiction that has passed that 4% bar. That more than 4% of all deaths are caused by MAID in Canada. Not even Belgium, which is just next door to neighbor, which is a next door neighbor
Mm.
to the Netherlands, managed to pass that until like 20 years later.
Okay, so the question is, why are more people with longer life expectancies being allowed to choose Maid? Are they not receiving any other options for care or support in their situation?
So it's a good question because we have a very difficult time accessing the data that will look into this. It is what is clear is that MAID providers are more willing to provide MAID instead of available medical treatment options. And we just have this figure that more people in Canada are dying from MAID this is a there's a fast growing segment of the total percentage of deaths. And as I mentioned earlier, it is now effectively the fourth most common cause of death in Canada.
Wow. Okay, well, after the break, we will discuss more, but so much for rigorous standards. Stay with us. Okay, so this is where I get personal. As someone who experienced depression and suicidal ideation as a teenager, this hits home for me. I am here today because people cared about my well being physically, emotionally, and spiritually. I can't imagine what choice I could have made without those supports. So, Alexander, in court, the trial judge accepted the opinion that system safeguards and processes substantially decrease the risk of an involuntary, non decisional, or mood dependent death by lethal ingestion. How has that played out in reality for us Canadians?
Well, the reality is that what the court system recognized was that they looked at the data in Oregon and they saw that somewhere around a quarter of all assisted suicide deaths were patients who had depression. And
Wow.
amongst, or sorry, I should say around a quarter were those who requested assisted suicide in Oregon. And yet none of them dying through assisted suicide. That led the courts to decide, okay, so patients who have depression will be protected. The
Mhm.
reality in Canada is that that isn't happening. And while we don't have national data amongst individual hospitals, we see that patients with depression are overrepresented in the number of May deaths. And I should also mention that you are living proof that most people with anorexia beat anorexia. Anorexia is a treatable condition. It's a
Exactly.
treatable mental illness. Most
Yep.
people recover except they don't have the chance to recover. It's suicide is being offered to them instead of an adequate medical intervention.
Exactly. And we know that depression easily follows a terminal illness or chronic conditions or disabilities. So, how do we determine if it is depression driving the desire for MAID?
So, according to an expert panel that the House of Commons struck on MAID and mental illness, they recommended the use of the MacArthur competency test. This is a very common test that's used in psychology, within psychology and
Mhm.
psychiatry, excuse me, to help determine whether a patient has the capacity to consent to medical treatment. The only issue with this is that I spoke with Paul Applebaum, who was the co-founder who co-developed the Griso MacArthur competency test, and he told me that he does not believe that this test or any test would be able to determine when someone's suicidal urges are driving them for May death based off of their chronic conditions or based off their depression. It is just a fallacy to believe that any physicians, and I should say that especially not a specialized physician in mental illness, and in Canada, that also would include nurse practitioners,
Mm.
who are wonderful people, but they are not, but both them and family physicians are not able to determine when there is treatment resistant mental illness. So the simple
Wow.
answer is no, there really isn't any specific system that's used in place. And we also have studies that show that even this very basic test is frequently not used for May deaths. And there was a study out of the Ottawa Hospital that showed that a very small percentage, I think it was roughly a fifth of all May deaths at that hospital, even had that capacity test done at any point. So no, everything is being just speed roaded through.
So, why is an inadequate test being used to help decide, oh, yeah, you can have MAID?
Well, I think the answer is that it's the easiest way of doing it. Virtually no people who apply for MAID are denied. And
Wow.
amongst those very few cases, we're talking about like single digits percentage. Amongst those patients, the largest reason for why they were denied was because of psychiatric illnesses, or they only had a psychiatric illness. And that is going to be a qualifying condition come next year.
Yeah. So, why is it difficult to determine the real number of requests for those who feel like a burden, since patients may have received assistance in death after experiencing subtle or overt pressure, facing unconscious suggestions by caregivers that their circumstances are hopeless, or sensing that they are a burden to families?
Yeah, I mean, roughly half of all people who die from MAID have died because they felt like a burden, a fifth because they felt like socially isolated. And Health Canada or different provincial authorities could investigate this. They could look into it, but have decided not to. And I think that they're trying to cover, they're afraid of what that data truly shows.
It would be interesting to see if that is actually the reason. We'll have to dig deeper on that. Okay, stay with us. In part one of this discussion, I mentioned from the report that a psychiatrist who testified in Canada Attorney General versus EF case also claimed to have assessed a patient with anorexia nervosa who would go on to die from Maid, as Parliament was deliberating on whether Canada was ready to expand Maid to mental illnesses. Maid on this basis was already happening, despite the eligibility criteria prohibiting it. This is also an area of great concern for me, as I shared, because I struggled most of my teen years with anorexia and bulimia. Recalling my own mental processing from that time period, I would have been extremely affected by the slightest suggestion of Maid's availability to me. So, Alexander, the lack of social support was a driving factor for choosing Maid for 6% of completed cases, according to the Oregon study. How has Canada, and you may have already mentioned this, protected those who are in social isolation?
So the figure that we have today is that in 2024, we have roughly half of all Canadians who died from MAID told their MAID assessors that they perceive themselves to be a burden to themselves, their friends, or their caregivers. This is a dramatic increase
Yeah.
versus what was presented to the courts as part of the Carter decision. We went from being a perceived burden, from being a deterrent for dying from assisted suicide in the state of Oregon. That was the conclusion from the trial judge, to now just being normalized that roughly half, one in two, of all people who die from MAID are going to perceive themselves to be a burden. We are not protecting the vulnerable.
It doesn't sound like it. So, when you take a look at the court shared that neurological illnesses pose significant risks for patient coercion, they're pointing that out toward assisted dying due to the higher rates of depression and cognitive impairment. But the trial judge once again concluded that a high level of scrutiny and great care would be applied to any decision. So, as you keep sharing, this has not been the Canadian reality.
This has not been the Canadian reality at all. And the irony behind this, if you can call it an irony, is that the Canadian Medical Association's original policy position on MAID was that it opposed legalizing assisted suicide because of the impact it would have on patients with neurological conditions, especially dementia. And the data in Canada is that in 2020, this is recent history, in 2020, only 31 people had dementia who died from MAID as their underlying illness, I should say. In 2024, that figure now is 368.
Oh my
So a
goodness.
tenfold increase between 2020 and 2024.
I yeah, I'm speechless. Okay. What about MAID deaths of persons with dementia? You mentioned diabetes and things like that, but what about like dementia? Like just how has this been
Yes.
influenced?
Yes. So that was the figure for dementia. For the figure for neurological conditions, that was as a whole, that was also a pretty large condition. So it was roughly 10% of all May deaths were patients with a neurological condition.
Wow.
So just to tell you, in total, it was roughly
Yeah.
2,300 May deaths whose underlying illness was only a neurological condition, and 360 of them were those who had dementia. So we're talking about a massive, massive increase,
Yeah.
just like with any other subgroup, protected subgroup, in Canada.
Yeah. It doesn't sound like there's a lot of safeguards actually being used. So, in my opinion, as early as April 2019, what did the United Nations Special Rapporteur on the Rights of Persons with Disabilities warn Canadian policymakers about?
She warned that her office had already seen Canadians with disabilities being targeted by MAID and choosing MAID not freely, not as a choice, but choosing it because they lacked available alternatives. So
There you
we
go.
cannot say that we did not know. We were warned about this from the very beginning. We continue to hear from disability groups that people with disabilities are overrepresented. And the data that Health Canada is reporting and yet choosing not to publicize as prominently is that Canadians with disabilities are overrepresented in the national data.
And as Albert Einstein says, the real evildoers are those who are passive. All right, Alexander, we could go on and on and on, but thank you so much for coming on and spending these 2 episodes just trying to unpack what we already have in information. And I'm sure I'll have you on again. Take care.
Thank you.
I am thankful for the support I received as a youth struggling from eating disorders, depression, and suicidal ideation. And again later, when I endured over 15 years of debilitating environmental chemical sensitivities, support was there. I have suffered, but enjoyed a full life. First and foremost, people helped me live, not help me die. Like I quoted earlier, Albert Einstein suggested the world is dangerous not because of evildoers, but because of those who remain passive.